Depending on who you are as an individual, going after more glutes or more glute activation might actually not be the best thing for you to improve your posture and movement. In fact, it could be making you worse. I want to preface this by saying glutes are not bad and they're not good muscles necessarily. It's just context specific depending on what steps you need to take as an individual to improve your movement and also your posture. Let's break down why that might be. So I talk about a lot people stuck in this forward extension pattern. You can think about this as anterior pelvic tilt. You can think about this in PRI terms as a PEC pattern. You can think about it in a lot of different ways. But what's essentially happening is you have this pelvis that's forward in space and you've got this rib flare up front as a result of that. However, the body is concerned with keeping a center of mass evenly down the midline of the body. So if we feel like we're falling too far forward, what we're going to do is we're going to start to grip at the lower posterior pelvis down here, and that's going to help pull us down and underneath ourselves. These are people that often present with sway back posture. You don't even have to visually present with sway back posture for you to have this. It's all a gradient, and it's not like one day you magically wake up and now you have sway back posture. It happens over time. So some people are still forward and you'd look at them and say, okay, you have an anterior pelvic tilt, but they still have a degree of this gripping here. So what often happens at this lower posterior pelvis is the glutes become tight and concentrically oriented. The deep hip external rotators, like the gemelli, become concentrically oriented or shortened. And this prevents the pelvis from being able to open up in the back and go into internal rotation, which is these bones moving back and rotating back, and this outlet right here opening up like this. I have a video that goes into the mechanics of the straight leg raise test and another lower body test, which I'll link down below in the description. But just to summarize really quickly, in order for us to get beyond about a 45-ish degree straight leg raise, what we're going to see is we need to have this pelvis open up in the back. So these muscles need to be able to elongate. And if people don't have the ability to elongate those muscles, then their knee is going to bend early, or they're going to roll their pelvis from side to side, or they're just going to get stuck before that range. So the point is that these people are going to have a really hard time creating a genuine posterior pelvic tilt for one of two reasons. The first one is that they are already pulled down under into this sway back posture where all this gripping in the back is kind of shoving them down and under. So if they go to further posteriorly pelvic tilt, they're going to have a really hard time doing that because they're already being pulled under. If they try to create a posterior pelvic tilt from this position of this anterior pelvic tilt, then what's going to happen is they're just going to grip their glutes and they're going to shove their pelvis underneath themselves, and that would be lumbar flexion or lower back rounding rather than this subtle, genuine posterior pelvic tilt. A genuine posterior pelvic tilt is very, very subtle. It should not require you to lose any height in your skeleton, but a lot of people think it's just this, and that is not the case. So if you're one of these people and you go after your glutes right away, really all you're going to be doing is just creating more compression on the back side of your pelvis, and you're not really going to see a lot of benefit. I like to go off of objective tests all the time, and we'll know we're not going to have much success because the tests won't improve. Range of motion won't improve, and that's a very strong indication that we're not going to be seeing any visual progress either. Depending on the individual, we can do a couple of things to help improve this. If I have someone that's deep into this sway back posture presentation, their straight leg raise is going to be really limited, usually less than about 30 degrees, then I need to open up this space here, and then we can facilitate some more glutes later on. This is the standing posterior hip capsule stretch with an extension bias. The purpose of this is to open up the back hips and not overly round our back while doing so. So to set up for this, we want something that's around waist height. You can be a little bit higher or lower, but as long as you can rest your palms and forearms comfortably on it, in the end position, we're gonna be in a good spot. And then we want a book about an inch to inch and a half, maybe 2 inches max, underneath our back foot. And this book should be big enough that we can keep our whole foot flat on it. And then we want to be about 12-ish inches from this box or table or whatever you're using. So to set up for this to start, we want to get the front midfoot in line with the back foot toes. And then we want to bend both knees, and we want to get really heavy on our back heel here. In this case, this would be the left back heel, but again, the whole foot is flat. And then Trevor, I'll have you place your forearms right here. Great. Okay, so with this, we want to have a pretty straight back. We don't want to be overly rounded here. We want to be really straight, but not so straight that we're extending the crap out of our back. We want to just have a very flat spine. And now what we want to do is feel the inner edge of the foot arch on the front foot. In this case, it would be the right. This would be the ball of the big toe and the inner edge of the heel. That would be right here and right here, pushing in with about 20% of our body weight, and that's going to push our knee forward. The other 80% of our body weight is on that back heel. And now what we want to do with this nice flat back, we want to just exhale. Good. And then we want to inhale through our nose, just breathing through this with deep breaths in through our nose, out through our mouth. We should feel a big, big stretch in this back left hip, or whatever side is back. If I do have someone that's forward into this anterior pelvic tilt and they do have a degree of this back hip clenching, then what we can do is still give them control over the tilt of their pelvis via the inner hamstrings. I like to call them the semi-brothers that attach on the ischial tuberosities right here. So we can have them pull the pelvis back, and we can also do an exercise that will help promote the opening of the back side of the pelvis, which is that internal rotation like this. This is the 90-90 hip lift in passive internal rotation from Postural Restoration Institute. The purpose of this is to get us in a position where we can reposition the pelvis, restore a little bit more of a neutral pelvic orientation while driving a little bit of internal rotation through the femurs in this 90-90 position. So to set up for this, we need a ball which is going to allow us to keep our knee in line with our hip, but we also want to start with these feet slightly outside of our knees. This is that passive internal rotation aspect of this activity here. Now, the degree of which you are in this passive internal rotation should not be overly significant, so we're not way out here. We should just be maybe 10 to 15 degrees of internal rotation. So about here is what we're going to be looking for. Now, what we're going to do here is place our hands on our low ribs, maintain contact of the foot, and this is really important, of the heel and also this base of the big toe where the ball of the foot is here, and not losing this lateral toe right here, but focusing on this part right here and the inner heel. And we're going to keep our foot on the wall, and on both sides we're going to think about dragging down on the wall with that inner aspect of the foot where the foot arch would be, and that'll naturally tuck our hips off of the ground slightly. So the tailbone comes slightly off of the floor, and we should feel our inner hamstring muscles as we do that. And now what we're going to do is just maintain this position, exhale through our mouth, big open mouth sigh, for about 5 to 10 seconds, keeping our stomach relaxed. And the only reason why we feel any tension whatsoever is because we are getting recruitment of our side abs through that long, extended, and soft exhale. That's why it's 5 to 10 seconds long. And then we're going to maintain a slight amount of tension in those side abs as we inhale through our nose, keeping our mouth closed. And that's going to expand our chest and our back. And that's exactly what we're looking for there, all the while maintaining those foot pressures and feeling those inner hamstrings on both sides. From there, we have created the ability to open and close the backside of the pelvis. The femurs have more room to go into internal and external rotation, genuinely. I also see people go after their abs to help control the tilt of their pelvis. However, there's a big difference between the six-pack abs here and the side abs, the obliques, and the deeper abs. The six-pack abs attach on this lower rib cage right here and the very bottom of the pelvis. So when they contract, they actually pull the sternum down and the pelvis underneath them. The obliques, however, have more leverage to create more of this genuine posterior pelvic tilt because their attachments allow them to help create that rotation of the pelvis down and the rib cage down right here without slouching or losing a lot of height in the skeleton. This is why I care so much about a good exhale in a lot of these exercises that you see on my channel, because the exhale will help facilitate the obliques or the deep abs, the transverse abs, to help pull the rib cage down and the pelvis underneath, and that will help create a more genuine posterior pelvic tilt without us just exhaling everything really strong or just trying to consciously crunch really strongly to help get the pelvis underneath us. That's not necessarily going to be conducive for our goals here. On that note, if I have someone that's really struggling to control the tilt of their pelvis, I might put them in a passive breathing position and have them just hang out there and focus on a nice full exhale that's also relaxed, minimizing the engagement of the six-pack, because that's going to allow them to get a little bit of that control of the tilt of the pelvis without overly crunching or slouching. Now, all I want you to do, Trevor, is I just want you to just chill in this position. Exhale through your mouth, nice and long, big open mouth. Trying to stay as relaxed as possible. The only tension he's going to feel in this exercise is going to be these side abs very slightly as he finishes that full 5 to 10 second exhale through his mouth. He's going to keep a very slight amount of that tension in his side abs as he inhales, exhales all of it out. Very, very relaxed. If he wants, he can place his hands on his low ribs to make sure that they're going down just a little bit as he finishes that full exhale. There may be a couple modifications we will ask you to do in this activity. The first would be to get a towel roll about this thick and place it underneath your hips. So your low back can still stay on the floor, but it's just now putting you in a passive tucked position. And if this is the case, that's all you need to do. Your low back is flat on the ground, you're not thinking about anything, all the cues are still the same. We can also use a modified pigeon stretch to help open up that space, and this can be a really good starting point as well for these people who really struggle to get rid of this butt clenching. So in this position, we want to start off in what most people would probably consider a traditional pigeon position. So we want this leg to be as parallel as possible to the wall ahead of us or perpendicular to our body. So Trevor's probably as good as he's going to get relative to where his body is at. But if you can't get all the way up, it's not the end of the world. Just make sure that you can get as high as you can get this ankle right here in a comfortable position without it being painful or discomforting. And then what we want to do is we want to place these back toes on the ground, and then we want to extend this leg. Very good. Now, Trevor, I'll have you drop down to your forearms with your palms up. Very good. Keeping your head slightly up. Now, what I want you to do is I want you to exhale and reach this heel back just a little bit towards that wall behind you. He should feel a big old stretch in this lower right glute area here. And then he's going to inhale through his nose, exhale through his mouth, and reach that leg a little further back, which will intensify the stretch. As he exhales, it should be nice and soft through his mouth. It should be really, really relaxed, but that should also be long enough to allow him to get a little bit of side abs here. As he feels that, at the end of the exhale, inhale, and that should expand all through here. And then exhale, reach a little further back. Doesn't have to be much at all, a couple of centimeters could be perfectly acceptable here. From there, I tend to see people have much more success, not only feeling their glutes work in the gym or with exercises that help facilitate more hip extension or hip external rotation, but also they're going to see better improvements in their test results, which is what I ultimately care about.